So today we're going to talk about semaglutide. Semaglutide is a drug called the GLP-1 receptor agonist. So GLP-1 receptor agonist drugs are used for weight loss and also to reduce blood sugar. Semaglutide in particular is an injection that is used with diet and exercise together to keep weight off from patients who are obese and also from diabetes. So the main thing to remember before using semaglutides for weight loss is the downside of this drug is it puts you at high risk for thyroid tumors, pancreatitis, and also GI symptoms of diarrhea. Because the blood sugar drops with this drug, you'll have a tendency to have disease spells like vertigo and fatigue. So we have to make sure you don't have any thyroid disorders before we even start the patients on these drugs. And we have to check the kidney functions, liver functions, make sure they don't have any pancreatitis signs, and they don't have any nausea, vomiting, or GI symptoms to begin with. And then these patients will also have diabetic retinopathy as a complication, so we have to make sure they go through a ophthalmology to have periodic eye exams, because it can lead to disruption in the blood vessels of the retina, which leads to vision problems. Kidney issues, mostly these patients have poor kidney functions, which is elevated creatinine, hypoglycemia with semaglutide dropping the blood sugar, and patients feel dizzy, weak, and tired all the time, even when they are not diabetic. That's a common side effect. GI issues are usually nausea, vomiting, diarrhea, constipation, which is with any other drugs anyways. Pancreatitis symptoms, these patients will have severe abdominal pain, nausea, and vomiting, and then we need to make sure they're not going through that acute inflammatory process of the pancreas, and we have to stop it. That's why we ask the patients to come in every 3 months. Actually, first initiating drugs, we had to see them within 6 to 8 weeks and do all these work, and then we have them come back in 3 months and one more 3 months follow-up, knowing that the patients are going to be okay. So it will reduce weight and also drop your blood sugar, and it's FDA approved for diabetes and also weight loss reduction.